Assalamu alaikum everyone. So today we have organized a webinar on the importance of routine immunization, especially in the current outbreak of COVID-19. So today's speaker are Dr. Tariq Masood and Mr. Suneel Raja. So Dr. Tariq Masood has joined us. Dr. Tariq Masood has started career in Department of Health, Government of Sindh as a medical officer in 99. And he has worked as a disease surveillance coordinator and district EPI focal person and SIA focal person for 5 years. He joined World Health Organization of Pakistan as a surveillance officer at Karachi and later promoted to senior surveillance officer for Sindh province as a national professional officer for WHO. He worked for overall 9 years in World Health Organization. Later, he worked with UNICEF and after that he joined John Snow Incorporation in February 2016. And currently he is working with John Snow Incorporation. He also led immunization work in 16 districts during USAID flagship program of MCHIP and led the development of detailed plan for improving routine immunization in Karachi, that is roadmap to achieve universal immunization coverage in Karachi. So Dr. Tariq, you are most welcome to this webinar. So would you like to introduce our audience about some concepts related to routine immunization and how this program started in Pakistan?
Yeah, thank you so very much, Jaishri, for the nice intro. And thank you, audience, for joining us for this very important webinar. I would like to share my screen to take the audience for today's topic, I would say. Let me share the screen, if it is. So, can you see the screen?
It's not visible yet.
Okay, let me try again. Is it okay now? Can you see the screen now?
It's still not visible. Okay, now it's visible.
Okay, so guys, the expanded program on immunization.
Wait a minute, Dr. Tariq, you can make it a full screen in a slideshow.
Okay, so the EPI, that is the expanded program on immunization, started in Pakistan from 1978 against tuberculosis, diphtheria, poliomyelitis, pertussis, and tetanus, and measles. Then later on, the hepatitis B, hemophilus influenza type B, PCV10, IPV, that is inactivated polio vaccine, rotavirus and typhoid conjugate vaccine, TCV, included in the schedule. Of course, the routine immunization aims to reduce the morbidity and mortality from vaccine preventable diseases. I'll just quickly take the audience there. What are we talking about today? See some pictures, some horrible pictures. On the left side of this slide, you can see a child who suffered with type 1 of polio, which affected his right leg. And then after a few months, he affected with type 3 of polio, which affected the other leg of the body. And on the right side, you can see the cubes. This is the picture not from India, Pakistan, or Africa, but this is from USA, taken in 1945, which contains the these are the isolators, which are having the patients, the humans inside these isolators, not affected by COVID but by polio. So, like the scenes which we are seeing today for COVID-19, the same scenes were in USA in 1945 when the polio outbreaks occurred over there and when it occurred globally. So we are treating diseases like poliomyelitis and immunization. In addition, tuberculosis, you can see Pakistan is unfortunately among 5 countries which has the highest number of TB in the world. This is also unfortunate. Another disease, diphtheria, and you can see the mouth opening from where we can eat and drink is closed, is blocked with membrane, which leads to death. You cannot eat anything, you cannot drink anything. Then other disease, neonatal tetanus. This is manifested by the fits and lockjaw, and this leads to death within few days. It's a horrible disease as well. Pertussis, another killer disease, which estimates more than 300,000 children deaths annually worldwide, even today. Then pneumonia, then and the associated illnesses like meningitis, bacteremia, middle ear infection like otitis media, sinusitis, and bronchitis. All these are complications of pneumonia. And then, of course, the meningitis, which we call gardan do bukhar. This is another leading cause of morbidity and mortality. Hepatitis B, you all know very well. This is one of the major cause of liver cancer as well as due to the hepatitis B virus. Then some of the complications of measles, which can cause long-lasting disabilities. A child with post-measles corneal scars, you can see number of complications which are caused by the measles disease, which leads to death even. And the complications include diarrhea, middle ear infection, pneumonia, vitamin A deficiency, and severe cases go blind, and then encephalitis as well. So, if we talk about the global disease burden of vaccine preventable diseases in the world under 5 years of children, the 17% of the global total mortality belongs to this group. These diseases which affects children mostly, these belongs to the pneumococcal diseases, rotavirus diseases, pertussis, Hib influenza, measles, tetanus, and other diseases which we talked about. So all these diseases can be prevented through vaccines, and millions of lives can be saved through vaccination. And we have already saved millions of lives through the vaccination. So I'll stop here, Dr. Jaishri, and will I mean, discuss further if you want to invite me again for any further question. Thank you.
Thank you so much, Dr. Tariq Masood, for giving this background on the expanded program on immunization in Pakistan. Okay, so I'm also expecting another speaker. Unfortunately, due to some technical errors, he could not join to us, but we can continue our session and he will join us sometime later. So, Dr. Tariq, can you tell us about the ideas about the routine immunization? Okay, so like how the currently program is going, especially in Sindh province, and can you also share some information about the schedule of vaccines which EPI is giving currently?
Okay. Again, I would like to take you to the schedule. Definitely, this is very important question because the people should know what are the diseases which against which we are providing the vaccines, and then of course where are these vaccines been provided, and and then I'll come to your second part of the question. See, uh, what EPI aims is to vaccinate the children under 1 year of the age, and those children who do not get vaccine under 1 year are given another chance to complete their vaccination schedule by the end of second year. We have 11 diseases for which we vaccinate our children in the EPI schedule. There are lots of diseases against which the vaccines are available globally, but this is decided in the context of the country, which disease is prevailing more in which part of the world or which part of the country. So in our part of in our country, we have still polio and the diseases which we have seen a while ago, the measles, diphtheria, pertussis, tetanus. So what we advise that the parents to bring their children for to EPS centers for 6 times from the birth till 15 till the child gets 15 months of age. And we start with BCG and OPV when the child born in the very first visit. And then in the second visit, child is vaccinated with OPV for polio, pneumococcal vaccine, rotavirus vaccine, which prevents against diarrhea, and pentavalent vaccine. Now, pentavalent vaccine contains the vaccines against 5 diseases, which includes hepatitis B, diphtheria, pertussis, tetanus, and Haemophilus influenza. And with this, we also uh, advise to bring the child after 1 month for the third visit, and we repeat the same second dose of the same antigen, same vaccines which we gave during the second visit. And when the child reaches up to the 14 weeks, which is 3.5 months, the child is given the third dose of OPV, pneumococcal vaccine, and pentavalent. And then we replace the rotavirus with IPV. IPV is another form of vaccine against poliomyelitis. When the child gets 9 months of age, we gave them vaccines against measles and typhoid, and the second dose of IPV. And when the child becomes 15 months of age, we give the second dose of measles. So, in brief, we have 11 diseases. From the birth till 15 months, we recommend to bring the child 6 times to the care center. So, what parents have to do only is to bring their children for 6 times to the nearest TPI centers. Now, the question which you asked, ma'am, about the vaccination coverage in Pakistan and in Sindh. See, it's the right of every child to get all these vaccines, which I just mentioned, before the completion of first year of the age. But unfortunately, not all children are that lucky who gets all these vaccines, which is their right. And the vaccination coverage survey, which was conducted in 2012 and 13, followed by mixed survey in 2014, and then in the follow-up survey in 2017. You can see the coverage is not that good. What WHO recommends that every district should have 90% plus coverage of fully immunized children. The children who receive BCG, 3 doses of Penta, OPV, and PCV10, 2 doses of IPV, 2 doses of Rota, and 1 dose of measles at least before the completion of first year of life. If the child get all these vaccines, which I just explained, then we call the child as fully immunized child. If a child hasn't received any vaccine, we called it a zero dose child. And those children who started their vaccination schedule, but they could not complete their schedule due to any issue, we call them partially vaccinated. So these charts are for fully immunized children, and you can see the whole country, Pakistan, in the 2012 and 13, it was having, I mean, 54% coverage. So only 54% children received all their due doses within the speculated time, which is under 1 year. And you can see Sindh province, which was at the verge of 29% only. And the worst thing in this that only 14% of rural parts of Sindh province children were vaccinated. When this results came, everyone really was shocked and was jolted by this data, and then they started to work towards routine immunization more than the other priorities as well. So with the passage of time, although we are improving, but you see the mixed surveys was conducted in Holson province through UNICEF, and
Uh,
it showed.
Dr. Tariq,
Yeah,
I think your slides are not moving. I think you are discussing slide number 15, but it's still on
yeah.
slide number 13. So can you make it visible for our audience?
Is it okay now, or I think this technology issue is
Ah, yes.
yeah. Let me go back and try to share this slide again. So is it visible? Can you
Yes,
see the
this is,
coverage? Yeah.
yes,
Can you see? Okay.
I can see the map of Pakistan, which is showing the coverage by different regions.
Okay, so this is what I was talking about a while ago, and thank you for pointing it out. So 2012 and 13 highlighted that Pakistan, the coverage of routine immunization in Pakistan for fully immunized children is only 54%, with Sindh only 29%, whereas the mixed coverage shown in Sindh was 43% in 2014-15. Then the latest survey we have is of 2017, and this is showing some improvement, but still Sindh province is lagging behind. It is standing is still under 50, which is 49%. Though with the passage of time we are improving, but improving with very slow pace, I would say. So unfortunately, the results are not that much promising, which is still resulting in the occurrence of cases with measles and polio and diphtheria and other pertussis and other diseases which are vaccine preventable, like TB, pneumonia, and diarrhea. So until and unless we cannot reach 80% and beyond across in province and across country, the occurrence of cases and will be prevailing, and the children will be affected. So हम बार बार जो ये देखते हैं अखबारों में भी, मीडिया में भी, कि फलां जगह पे इतने केसेस आ गए, फलां जगह पे इतने आउटब्रेक्स हो गए या डेथ्स हो गई। ये बेसिकली इसी वजह से है कि हमारी कवरेज 80% प्लस नहीं है, जिसमें जो भी 2 साल से छोटे बच्चे हैं उनको जितने भी हमारे रिकमेंडेड डोजेज हैं पोलियो से लेके मीजल्स तक, वो सारे जब तक नहीं मिलेंगे हम उन बच्चों को इन जानलेवा बीमारियों से नहीं बचा सकेंगे।
अच्छा डॉक्टर तारिक, इसी से रिलेटेड मेरा एक सवाल है। तो हम देख रहे हैं फिगर्स भी हमें यही बता रहे हैं कि कवरेज इज़ टू लो। सो व्हाट आर द मेन रीजंस फॉर दिस लो कवरेज, स्पेशली इन कॉन्टेक्स्ट ऑफ सिंध प्रोविंस?
मैडम, इसमें डिफरेंट स्टडीज कंडक्ट की गई ये जानने के लिए कि क्या क्या वजूहत हैं, क्यों पेरेंट्स को इतनी इसकी अपने बच्चों की वैक्सीनेशन क्यों हम नहीं करवा रहे हैं। सो बहुत सी इसमें वजूहत हैं। पहली जो वजह, यानी 2-3 कॉन्टेक्स्ट हैं। एक तो कम्युनिटी से रिलेटेड इश्यूज हैं, एक जो प्रोग्राम सर्विस डिलीवरी से रिलेटेड इश्यूज हैं। कहीं हम देखते हैं कि अगर EPI सेंटर या तो कम है इस एरिया में, या वैक्सीनेटर कम है, या अगर हैं तो लोगों की इल्म में नहीं है कि किस जगह पे वो वैक्सीन प्रोवाइड हो रही है। तो ये शेड्यूल लोगों तक पहुंचना बड़ा इम्पोर्टेंट है, और ये बड़ा यानी कि लोगों को, जब मुझे अगर पता ही नहीं है कि कौन ये वैक्सीन मुझे किस जगह में लगवा सकता हूँ, ये फ्री ऑफ कॉस्ट मौजूद है, तमाम बीमारियों से मौजूद है, के अगेंस्ट मौजूद है, लेकिन मुझे पता ही नहीं है, तो मैं उस सर्विस को अवेल नहीं कर सकता। तो लोगों की नॉलेज के कौन कौन सी बीमारियां हैं जिसकी बचाव के टीके मौजूद हैं, फ्री ऑफ कॉस्ट लगते हैं, कहाँ कहाँ लगते हैं, किस दिन लगते हैं, और दूसरा ये कि उस शेड्यूल तक फिर अगर टीके लगते हैं तो कई उस कुछ फॉर एग्जांपल जो हम देखते हैं कि कभी बुखार हो गया उस टीके लगने की वजह से, या स्वेलिंग आ गई, पेरेंट्स समझते हैं कि जी ये साइड इफेक्ट हो गया और ये खराब है, टीका सही नहीं है, जबकि वो बुखार होना या उसकी स्वेलिंग वगैरह, या एटलीस्ट बुखार होना, वो बता रहा होता है कि वैक्सीन सही काम कर रही है। तो कुछ इश्यूज हैं जहां जो सर्विस डिलीवरी लेवल से रिलेटेड हैं, जैसे मैंने अर्ज किया, अगर कहाँ पे सेंटर्स की कमी या वैक्सीनेटर्स का कम होना, या दूर दराज इलाके जहाँ से वैक्सीनेटर्स या EPI लोग उन सेंटर्स तक कम पहुँच सकते हैं, और प्लस में जो हमारी अर्बन एरियाज के हवाले से अगर हम बात करें तो बहुत से पेरेंट्स हैं जो जॉब करते हैं, यानी दोनों फादर मदर जॉब करते हैं, उनके लिए कन्वीनियंट टाइम या सेंटर मौजूद नहीं है। दूसरा, इसके बारे में लोग जो डिटेल जो स्टडीज की गई, उसमें जो सबसे ज्यादा जो नुमाया होकर आया 2-3 चीजें, उसमें एक ये भी था कि जी लोगों को उसकी इम्पोर्टेंस की, उसकी अहमियत का पता नहीं है कि जी उसकी क्या अहमियत है, किस चीज़ों से वो बचा सकती है। दूसरी प्रायोरिटीज उनके लिए ज़्यादा है। वो समझते हैं कि जी मुझे काम पे जाना बड़ा इंपॉर्टेंट है, 6 दफ़ा बच्चे को वैक्सीनेशन सेंटर पे ले जाना और इतना इम्पोर्टेंट नहीं है। फिर फियर है साइड इफ़ेक्ट्स का, ये बड़ा सिग्निफिकेंट एक होकर सामने आया, और मिथ्स हैं कुछ के जी टीके कुछ उसके नेगेटिव असरात होंगे, जो कि ऐसा कुछ नहीं है। सो ये सारी वजूहात हैं जिनको एड्रेस किया जा रहा है, और इस वक्त स्पेशली जो सिंध EPI या पाकिस्तान EPI प्रोग्राम, जो कुछ रिसेंट स्टडीज हुई थी अर्बन इम्यूनाइजेशन के, उसकी बेस पे जो डेटा जो हमने जनरेट किया, तो एविडेंस बेस्ड डेटा के बेस पे कुछ इवेंट्स किए जा रहे हैं। ज़्यादा से ज़्यादा हम EPI सेंटर्स खोलने जा रहे हैं, प्राइवेट सेक्टर में स्पेशली हम खोलने जा रहे हैं। और जो रिफर्बिशमेंट है EPI सेंटर्स की, यानी कि बेहतर उसको आउटलुक देना, जब लोग बच्चों को ले आए तो उनको बेहतर फील हो वहाँ पे, और वैक्सीनेटर्स की कैपेसिटी बिल्ड करना, गाइड कर सके पेरेंट्स को कि अगले टीके के लिए अपने कब बच्चों को वापस सेंटर पे लाना है, और क्या क्या आपने एहतियाती तदाबीर करनी है, बुखार की सूरत में क्या करना है। तो ये सारी एक्चुअली ये सारी मैसिव ड्राइव इस वक्त चल रही है, और उसमें होपफुली वी आर सीइंग द रिजल्ट्स, बेटर रिजल्ट्स एज वेल।
Thank you so much, Dr. Tariq. Mr. Suneel Raja also have joined us. Suneel, can you hear us? Okay. There are certain questions from our audience. Okay, so we will take their questions. I think someone, Channa ji from Facebook, have connected, and they are asking about the measles booster dose, like the measles dose, I think, which is given at the 15 months. So,
Yes.
so I think he wants to know that if we are considering first dose of measles as a fully immunized, then the second dose is considered or not considered, then why it is
Very,
considered?
very much considered. See, even we were giving the vaccine, the one dose of measles, children were getting affected by the measles. Reasons being here, we have, the viral load or attack rate is quite high, so it was not protecting the child with one dose of vaccine. So the the global forums like WHO, UNICEF, and all the national technical advisory groups, they discussed this issue, and they advise for the repetition of the measles dose after 6 months of age, which is falling on 15 months of age. So it is very much important. Whereas this question of FIC, fully immunized children, this is the global definition. Not all the countries we give the second dose of measles, but the child is recognized as fully vaccinated, fully immunized at least if he receives all these antigens before completion of first year of life. We have the chance for the child to get the missing doses of second dose of measles, but the standard case, the definition globally is FIC by the end of first year of life.
Okay, and there is another relevant question. What if a child misses a dose? For example, parents do not get time, or for any reason, child could not get required dose on time. Then how
Yeah.
long after that a child can receive the same vaccine, like a month or 15 days or till 6 months?
It's no issue. Once the cells go enters in the body, it remains in the memory cells. So once it is missed, maybe 1 month, 2 months, or even 6 months, or even before the completion of 2 years, sooner than later. If the child is missed for 6 months, he did not receive the consequent dose. It's better to go even after 6 months or 8 months, whatever. But before, the leverage is to 2 years, so better to complete as soon as possible.
Okay. And here is another question from the audience. They are also raising a point that there are deficiencies of facilities in the rural areas of Sindh.
Hmm.
So
Yeah,
it is also one of the main reason that why immunization coverage is low in Sindh, because there are a lack of facilities or limited number of facilities available in
one
rural areas.
Yeah, one of the factor you can say, because the traveling matters in interiors, and especially in hard to reach areas like Tharparkar, Umarkot, or Kambar Shahidadkot, sort of areas. And I mentioned that is one of the reason that our coverage is not reached. But now, if you see the number of EPI centers, we have at least one EPI center in each union council. We have even 10 EPI centers in one union council. I would give example of Sadar Yusufai, but not in all union councils, but in rural parts, this does matter. But on the other side, when we see the COVID vaccination, We have not that much vaccination centers in Karachi or Sindh in comparison to the EPI vaccination center. But people are reaching there once they know the vaccine is available here. You can, and this is a threat which we see. Unfortunately, the threat for routine immunization has not been that much flagged in the community or media. So that is one of the reason, and as I mentioned already, that private sector has been tapped more for this, and the every effort has been applied to increase the number of EPI centers.
Okay. And there is one comment from Niaz Ahmed. Okay. He is asking about follow-up of missed children through the Zindagi Mahfoos app. Okay. So he is suggesting. Hello. Okay. So unfortunately, Dr. Tariq Masood disconnected due to some technical errors. He is going to join us soon. So meanwhile, Mr. Suneel Raja has connected to us. And let me introduce Mr. Suneel Raja. He is working as a communication consultant for expanded program on immunization in Sindh province. Okay. So Suneel, welcome. And because we have started this webinar on the occasion of World Immunization Week. So can you tell our audience that what is the importance of this World Immunization Week and why it is celebrated? Sunil, we cannot hear you. Sunil, I am not able to hear you. Can you please check your mic? Hello? Sunil, can you hear us? Hello, Sunil, can you hear us? Okay, otherwise
Sorry,
we
sorry,
can
this was
continue.
disconnected.
Okay. Okay. Yes, Dr. Tariq.
Uh, Yeah, so the question I missed, unfortunately. If you can just quickly
Okay.
repeat your question,
One
please.
one of the our one of the person from the audience, Mr. Niaz Ahmed, asked about the Zindagi Mahfoos app. So he is asking that this is one of the nice strategy to follow the missed children, okay, or to enhance the immunization coverage. Okay. So do you have any comments on this strategy or use of this app?
Yeah, fully agree, because this is era of technology. If we are not using the technology to achieve our goals, our targets, we are, missing the target. So ZM app is, Nyasab has mentioned. I would just like to highlight that it's a app. When a vaccinator vaccinated child, they enter the data of their child in that app. So then when the next dose is due, the message goes to the parent that the due dose of your child is coming. So kindly bring the child at the EPS center. Likewise, the message goes on the one day before the vaccination schedule, and then on the day of schedule and 1 week if the child is not coming to the center. So it's a very good app and multi-purpose app. I would say that you can extract the list of children vaccinated, extract the list of those children who are defaulters, who are not coming, and having their addresses. One can reach their house to vaccinate the child if they are not coming to the centers. So that is really very important technological use for routine immunization as well.
Okay. And Mr. Niaz Ahmed also asked about the cold chain management.
Mhm.
So, how cold chain management is functioning in the EPI centers, in especially in Sindh province?
इट्स वेरी
Is
इंपॉर्टेंट क्वेश्चन बिकॉज कोल्ड चेन के बगैर वैक्सीन ऐसे ही है जैसे मछली पानी के बगैर। तो उसको मेंटेन रखना फ्रॉम +2 to +8 वेरी मैंडेटरी फ्रॉम द पॉइंट ऑफ मैन्युफैक्चरिंग टिल इट रीच टू द चाइल्ड। और उसके लिए जितना मैसिव इन्वेस्टमेंट या जितनी जो एक्सपेंसेस जो उस पर लगाए जाते हैं फ्रॉम वर्ल्ड हेल्थ ऑर्गेनाइजेशन, यूनिसेफ, गवर्नमेंट्स, तो सारे हर स्टेप पे इसको चेक किया जाता है। स्पेशल किस्म के आइस लाइन्स रेफ्रिजरेटर्स बने हुए हैं जिसकी एक की कीमत 5-5 6-6 लाख है। वो हर ईपीआई सेंटर में प्रोवाइड किया गया है। इन एडिशन जहाँ लाइट का इशू है वहाँ पर सोलर आईएलआर दिए गए हैं, आइस लाइन रेफ्रिजरेटर्स। सो बहुत सी स्टेजेस पे इसको चेक किया जाता है कि इसका टेम्परेचर 2 to 8 है, मेंटेन रहा या नहीं। हर वैक्सीन के वायल पे एक मॉनिटर लगाया गया है जिसका ग्रेडिंग है, जिस पे आप चेक कर सकते हैं कि हैं अब इस पे किस स्टेज पे, यूजेबल स्टेज पे है या नहीं है। सो बहुत क्रिटिकल पॉइंट है, इसलिए हर स्टेक होल्डर ने इसको ड्यू इम्पोर्टेंस दी है ताकि इसको मैनेज कर सकें और जो वैलिड डोजेज हैं, जो क्वालिटी डोजेज हैं, वो बच्चों तक पहुंचे।
okay. Dr. Tariq, the program director of expanded program of immunization, has joined us now, and we take this opportunity to have few words from the program director of EPISIN. So, most let's welcome Dr. Mohammad Juman Bahuto. So, sir, would you like to give some comments on the this on the occasion of this immunization week, and especially related to immunization status of Sindh province? So, please, sir.
Uh, Thank you so much. You have given me opportunity to have few comments on this important occasion of World Immunization Week being celebrated in Sindh as well as globally with the theme of vaccines bring us closer. So I think that during this period, it is our responsibility to reach every child at community level for appropriate vaccination and ensure not only the availability of vaccines and other logistics at the API centers, but at the same time to ensure the access of the community to the API centers. Our vaccines during this COVID pandemic, they play vital role by averting the pandemic and bring us closer and decrease the fear which has emerged during this pandemic phenomena. At the same time, I would like to give message to all the community, especially the mothers, that they must bring their children to the EPI centers to get vaccinated. If they have certain myths, certain questions, then they can ask, they can discuss with the EP, district EPI focal persons, our dedicated vaccinators, because sometimes there's a fear that the 3 doses children, they are very, as they think that the children's, they are small, their age is a couple of months, so how vaccinator can give 3 doses at the same time. So these are the myths. 3 doses are given at the same time. These are the guidelines of the WHO and implemented all over the world. And if we do not follow these guidelines, like delay the dose of IPV, so there are more chances that uh, the defaulter may increase and we would not get the appropriate benefit of the vaccines. Vaccines are intelligent, they are clever. Whenever they enter in our body, they they are determined to work for our body, to recognize the antigen threats of the bacteria and virus, and they develop the immune response. So I think that we uh, along with the community, along with the forums, along with the universities, along with the other social sectors, we must play the role to immunize and achieve the targets for our community, for our children. Thank you.
Thank you so much, Dr. Saab, for joining our this webinar. Okay, and we are continuing with the questions from our audience. Okay, so here is one question from Lubna Shah, that if a child vaccinated with one dose of Penta and come for second dose of Penta after 3 months, then the institute or then the center should start with the first dose or should give him the second dose.
It will continue with the second dose in onwards. It's no need to repeat the first dose. As I mentioned earlier, that in memory cells it gets stores. Then the second dose will be counted. So no need to repeat the dose, but it will be second dose in onwards.
Okay. So thank you, Dr. Tariq. Now, Mr. Suneel also joined us. Mr. Suneel Raja is a communication consultant for expanded program of immunization. Okay. So, Suneel, could you
Ji, thank you.
can you hear us?
Yes, yes. Thank you very much for invitation, and really, it's a very pleasure for me to be here because I am also Sebastian, and I am also the graduate from the SZABIST from the Masters of Public Health. Thank you very much, and I hope all my colleagues are also listening to me, and not only the public health department but all others as well.
Okay. Um, Sunil, as you have joined now, we have discussed enough about the routine doses which are given
Yeah.
under the schedule of a routine immunization program for the children. Okay. Now, I would like to know some information about the current corona vaccination status. So, like how the corona vaccination is ongoing through the EPI system, and can you share some insights about the status of coverage of corona vaccine in the Sindh province? Uh, Sunil,
Sunil, we
uh,
cannot hear you properly.
okay,
Voice is
your voice
breaking
is
away.
not clear.
Please rephrase the question. Please rephrase the question.
Okay, so the first question was related to the vaccination, corona vaccination, which is also given through the EPI centers. Okay, so EPI is also taking lead in this vaccination process. And the second question is related to how routine immunization is affected because of this corona outbreak.
Uh, E- EPI is playing a very crucial role in especially the supply and management of the vaccines all over the Sindh. Currently, above 170 COVID vaccination centers are functional, and almost 7 to 10 are if, functional in every district. This is most important role being played by EPISIN program, and I think that the system which has been developed with the other partners and very intelligent technology has been used not only to supply the vaccine where it is needed, but at the same time to prevent the misuse of the vaccine. So this is very important role played by the vaccine our department, with the support and with the guidance of our Minister Sahiba, our Secretary Health, Honorable Secretary Health, and our respected Director General Health. Health Department has played very important role. Number two, it was this observed and thought that the COVID pandemic has no effect on the morbidity and mortality of the children. that is not a correct perception, but it has been seen, and the evidence supports that during the pandemic, maternal and child health services have suffered a lot. And these are the true indicators which are not only very crucial for decreasing the morbidity and mortality, averting the mortality among the pregnant women and children, but at the same time, uh, I think that immunization has been affected during the pandemic, but that was in the initial period because the hospitals were closed. There was a fear among the families. They are not coming to the hospitals and EPI centers. So this has affected the EPI achieving the targets and achieving the coverage of the antigens. But due to the guidance of the Sindh government, we have uh, overcome this issue of the less coverage of the antigens. I think now the EPI centers are functional, and community have learned that during this COVID, not only we have to give the COVID vaccine for our community as per the guidelines, but at the same time, the antigens which are given to the children, they are very important to save their life, to protect their lives, to make them healthy and stronger. Thank you.
Thank you so much, Dr. Juman Mahuto, for sharing the insights about the corona vaccination activities ongoing in the province and also how this outbreak affected the routine immunization. Okay. So now I'm taking the questions from the audience, and there are some questions asked by some member. One question came from Mr. Kamardin, and he is asking about the coverage of tetanus toxoid vaccine for women, for pregnant women. Okay. So he is asking if a woman vaccinated with one dose of tetanus toxoid only. So is she considered vaccinated with TT, or a second dose is necessary? And what is the status of coverage of tetanus toxoid among the women?
I,
Sunil,
we are,
Sunil, we are unable to hear you. Your voice is not clear due to some technical issues.
yeah, so I can take the question.
Okay.
Unfortunately, Sunil's voice is breaking away. We are really unable to hear Sunil properly, unfortunately. Uh, Thank you, Kamadin Saab. Well, we have for protecting the women and newborn against tetanus disease. WHO recommends 5 shots, 5 times vaccination of women at the different during different intervals throughout the this natal period. So one shot is really not giving any immunity. It's a zero dose, like it's the first dose just goes is a messenger, and it doesn't provide any immunity. So the second dose, which is repeated after 1 month, can give some protection for some period. The third dose is given after 6 months, and then the fourth dose is given after 1 year, and of the third dose, and the fifth dose is given after 1 year of the fourth dose. Or simply, the 2 doses of TT during the first pregnancy of a woman at 1 month interval, like first dose in the 7 month of the pregnancy and second dose in the 8 month of the pregnancy. Then the third dose during the next pregnancy, and 4 doses in the next pregnancy, 5th dose in the next pregnancy if there's. Otherwise, 2 doses in the first pregnancy, and then after 6 months, third dose, 1 year, fourth dose, and after 1 year, fifth dose. So that can give the complete protection to women as well as newborns, because newborn doesn't have the active immunity against tetanus when he or she is born. It acquire some immunity from the mother while through the placenta, and then when the child gets vaccinated and with the penta one containing TPT, the tetanus vaccine as well in it, then it starts getting active immunity. But before that, it is the passive immunity which can prevent the child from the developing tetanus. If Sunil can speak and he's audible, I will request Sunil to kindly explain, highlight the importance of World Immunization Week, please. If Sunil, if you can uh, fix the internet issues at your end and you can explain this out, this will be really nice to hear from you.
Uh, I think there are some connectivity issues at the site. Um, the voice is not really clear, so we can continue.
Can you hear me?
Yes, now we
Yeah.
can hear Sunil. Please continue.
Yes. Thank you very much. I am very apologies for the internet issues. And thank you very much, the SZABIST leadership, especially Madam Jaishri and Dr. Tariq, well spoken, and Dr. PTEPI, Dr. Jumal Bahuda, well spoken. Thank you very much. Actually, today is this is the great opportunity for us to discuss, highlight the importance of vaccination. Why today it is this webinar is being conducted? The importance of immunization week is basically importance of this week is basically let the community and people know the importance of vaccines, how vaccine works, and due to the vaccines development and vaccine availability, millions of children are vaccinated and are averted from the vaccine preventable diseases. So I think this is a very good opportunity to learn about the vaccines because this is the age of vaccines. COVID spread has proven that vaccine importance is very high, and through the vaccines we can save our children, even our elders, from the different diseases that can be prevented by the vaccines. So World Immunization Week is basically to let everybody know, and now I think it's a very good platform when we have the youth with us, the student, the youngest
Okay.
once they came to know the importance of vaccine, they definitely go and share with their families and friends, and if the information is multiplied, celebrate this week every year in the April from
Okay. Now I have few more questions from the audience, and the first question is from Mr. Muhammad Ali. He is asking that the corona vaccine. He has a question related to corona vaccine. Like, is it safe to give corona vaccine to those individuals who are already suffering with other comorbidities like diabetes or heart issues or similar issues? They are afraid that this vaccine might be harmful for them. So, what you say about this concern of the community?
Uh, during, I think the people who are suffering from the comorbidities like diabetes, hypertension, or other cardiac diseases, one of the most important thing here is to people should change their behavior to life, a life health style. So these diseases are to be controlled. If these diseases are uncontrolled, then the consequences of these diseases are very high. So first message is that these diseases must be controlled with altering their lifestyle. Second, the persons who are suffering or having comorbidities, they are at higher risk as compared to the normal persons. Therefore, it is mandatory that the persons with comorbidities, they must get vaccinated because they are at higher risk, and they don't worry that the vaccine is dangerous. Vaccine has is proved to be safe and effective. So the persons of our community should come to the CVZs where the vaccine is given. They must get them vaccinated and protected from the COVID-19.
Thank you so much, Dr. Saab, for this clarification. And I am taking one last question from Mr. Kamardeen. He is asking that why Pakistan is not starting vaccine production by itself. So, what are the hindrances and way forward? So, vaccine production. Is there a possibility that Pakistan can start vaccine production by itself?
Uh,
Should I respond?
Yes,
yes, Dr.
please.
Tariq.
Thank you, sir. That is very much unfortunate, I would say. There was time till 2003 when Pakistan was producing OPV, TT, and measles as well. I would be blunt in saying that there is some pharmaceutical, industrial politics behind this, or some idea of what you call fear of terror, that these things can be grabbed by some uh, anyhow. There are issues. There are issues. Pakistan is progressing on production of COVID vaccine in Islamabad. The trials are going on, and we are anticipating that in the month of May or max by June, Pakistan will start producing the COVID vaccine with the help and support and technical support from China. Whereas if you know that NIH Islamabad is producing the flu vaccines, which they are giving to all the patients who are coming due to allergies in Islamabad and KP and other areas. So we are producing, but not at the large scale, because this is a full-fledged industry, and definitely at times is to be recognized that some focus should be given on this very important productivity industry, I would say, productive industry, I would say. So there is certain pharmaceutical politics going behind this, which is start Pakistan producing the vaccines on the name of whatever. But now I think this is the time to move forward, in fact.
So thank you so much, Dr. Tariq. So
Yep.
now it's time to conclude our session. But before that, if you would like to have any final words about this World Immunization Week, or any message which which would you like to give to the community or to our audience?
Uh, should I respond?
Sure.
The message during this week for the community is that vaccines are safe. They prevent us from not only diseases but from the deaths. Therefore, rather than focusing on the myths and rumors about the vaccines, the community is requested that they get vaccinated not only from all vaccines which are available in the EPI SIN program, including corona vaccine, but as well as the government health departments trying to include other vaccines which are very important. So they must come the EPI centers. They must get benefit of this vaccination. Vaccines are very important for our not only averting the morbidity and mortality, but the economic growth of the Pakistan and Sindh. Therefore, I request all the community to come the health facilities, to come the EPI centers, and get them vaccinated and get them protected from the diseases.
So, with this note, I would like to conclude our session, and I am very much thankful for our speakers, especially Program Director EPI Sindh, Dr. Mohammad Juman Bahuto, and Dr. Tariq Masood from EPI Sindh, and Mr. Suneel Raja from EPI Sindh. So, thank you so much, and thank you, audience, for their uh, very important questions and showing your interest in our this webinar. So, thank you so much, all. Wish you nice day ahead. Okay, so thank you all. Allah Hafiz.
Thank you very much. Thank you, everyone.